Wildrose leader Danielle Smith was in Olds October 23rd, speaking at a fundraising dinner for the local constituency associations. We asked her what her thoughts were concerning rural health care following the Premier's recent announcement during his visit to Olds.
The local issues are, but I have to say I've been very disappointed that the Premier and his new health minister don't seem to understand the nature of the problem that the PCs have created over the last 20 years. The fact that they have centralized decision making to a point where they are stripping resources and knowledge out of local communities and decision making power out of local communities have led to the problems that we have today. If they, for me to have any confidence that they know what needs to be done to actually fix the problem, I would have liked to have seen them parallel the announcement that we gave a couple of weeks ago. Number one, we need an investment in home care. We've got to make sure that we allow for resources so that seniors can age in place as long as possible. We know that's what seniors want, but we haven't heard that there's enough investment in home care. Second thing is we need to make sure that we've got an increasing investment in long-term care. As seniors continue to age longer, we're going to see more instances of Alzheimer's and dementia, which require 24-hour nursing care beds. And the government has gone the opposite direction. Rather than opening more, they've been closing them down. And when a patient cannot be in an appropriate 24-hour care facility, when they go into the hospital, the doctors won't discharge them because they need to be able to have that care. That's part of the reason why we have 700 at any given time patients who should be in long-term care facilities who are in those acute care beds in hospitals, and it's creating difficulties across the entire system. And we see it because we're not able to reduce the number of waiting lists for key procedures. Plus, we also see a huge amount of wait in all of our emergency rooms as well. So making sure that we have enough long-term care beds and enough transition beds. Part of what we used to have before, and they started closing them down, were beds where once you'd stabilized a long-term care patient, you had a place for them to go while they were awaiting placement in long-term care. I've seen nothing from the announcements of either the Premier or the new health minister that they understand that these are key aspects that we have to resolve if we're going to be able to clear up the bottlenecks in our hospital system. And this is why we, as the opposition, are going to continue to press on them once we return to the legislature. The other aspect, of course, is we need to make sure that we've got enough medical practitioners coming to our rural communities so that everybody has a family doctor. We have not done a good enough job of being able to attract and keep talent in our communities, and part of it in being able to attract the best talent is ensuring that we've got full service hospitals in a lot more rural communities so that they become a place where doctors can practice through the full scope of their medical practice. So I think that what we've seen is 20 years of a PC government that is taking steps that is causing our system to be compromised, and we have to turn around some of those decisions. I don't think they will do it. I think it requires a new party to do it.
Olds Community TV, your go-to channel for news and information in Olds, Alberta.